Welcome to the SimTech Podcast, the show where we explore the world of clinical simulation, the technology driving it forward, and the people making it happen. I'm your host Craig, and today we're diving into the world of ExR, a platform designed to host and deliver 360 content, making immersive learning more accessible to healthcare professionals. Joining me is Jonny, one of the key people behind ExR. We'll be talking about how this platform is transforming the way clinicians and educators engage with simulation-based training, the challenges of making high-quality immersive content widely available, and what the future holds for ExR. So whether you're a SimTech, educator, or just curious about the impact of 360 video in healthcare, this episode you won't want to miss. So let's get into it. Hello and welcome to another episode of the SimTech Podcast. Today we are going into a Supplier Showcase and we're going to be talking about ExR. And to help me do that, I have got Jonny with me. Good afternoon, Jonny. How are you?
Yeah, very well, Craig. Thanks for having me.
Yeah, glad to hear. So I first saw you on, one of the what is now NHS England's monthly VR enthusiast meetings. How did you find the feedback from what you did there?
Yeah, it was really good. I've been inundated with meetings and interest, which has been fab. But yeah, it was great to see that there's so much interest. I think there's 100 people on that call or something.
Yeah, and like you say, and even though that it's quite a lot of people, but everybody is interested in all this kind of stuff, and that's why they're there. So they're very bespoke, and it's exactly about the listeners that listen. And we don't have a great deal of listeners, but everyone that listens is always really interested in this kind of line that we're going down. All ExR enthusiasts. All right. For those people that weren't on that meeting, Jonny, do you want to give yourself a little bit of a corporate introduction, who you are, and what's your plan, really?
Yeah, sure. Gosh, I've never been asked for a corporate introduction before. It's exciting. Yeah, so my name's Jonny. So I have a few hats, as many of us do these days. But so I'm a ENT higher surgical trainee up in the Northwest. I'm also a bit of a clinical academic. I have an honorary role at the University of Manchester and have supervising a PhD student currently who's taken on from some of the PhD work that I've done. And I'm a co-founder of ExR or ExR, depending on who you are when you read our name. So I can talk much more about that.
Yeah, so is ExR or ExR, which one's the form and which one's the latter? Which one's new, which one's old?
Probably ExR is what we go for at the moment.
Is that what you're going for?
I think so.
Anything specific? Or?
It probably stood for multiple things, so extended reality or extended reality education or education ExR. Yeah. Multiple things, but definitely people pull apart the meaning of the name depending on how they want to hear it.
Yeah, well, I'm not sure. Can you steal such a brand for yourself, saying actually we are ExR? I don't know if you can. I don't know if are you that bold to say, look, we are ExR now?
To be honest, I was probably created about 5 years ago with me and a friend, so we definitely weren't bold then. But.
So how have you? So for the people that weren't on the meeting and don't know, what's the goal of ExR?
Yeah, so I guess start by saying what it is. I mean, at the core of what it is essentially a central repository of extended reality learning experiences that have been co-developed across the NHS, various different universities, healthcare charities, and the aim is to create a place where people can really share learning content that they've created in their own organizations.
Yeah, and why did you want to do this?
Throughout my academic work and my clinical work and my educational roles within the NHS, I did see a lot of people creating content, then validating it as part of a research project. And the results were often very good in terms of educational outcomes, usability, and feasibility. But then it didn't really ever go anywhere. It was often created, these brilliant tools were created, and then they couldn't really be shared across the NHS. And that was one of the main aims, is to kind of support the healthcare education system by creating this ability to share learning tools.
Yeah, and when you say content, what kind of content do you mean?
So across the platform, we have two major groups of content. So we have content that's based around 360-degree video technology. So that either active or passive experiences that are created using immersive cinematography. The other side of the content is more the kind of serious games, as we like to call it. So these are fully immersive 6 degrees of freedom virtual reality experiences where you would assemble objects or perform an emergency procedure or go through a kind of more manual process using your headsets. So the immersive gamers work on virtual reality headsets only, but the videos work on all different types of devices, phones, tablets, as well as the kind of high-end VR headsets.
Yeah. So what kind of headsets would the 360 work on? And I know you said that you're not the technical brains of this, Jonny. So if I do throw you in at the deep end, just be like, hold on, not my bag.
Yeah, sure. No, so I mean, the companion application to the platform is on the official stores of the HTC, the Meta Quest store, and the Pico store. But the video, the 360 video, would work on any headset that has access to a browser. And we use something called WebXR to make sure it works on, the likes of the Apple Vision Pro or a maybe less expensive, less able headset. So it does work on every VR headset. And the 360 video works on phones and tablets. And, the Google Cardboard, the little cardboard thing that you put up to your face, it'll work on that too.
Yeah, so even like phones, those kind of things, would it work on?
Yeah, definitely, and that's part of the point. Is we're trying to get as many people that could learn from a virtual reality experience to do so. So by making it work on as many different platforms and headsets as possible, that's our way of trying to solve that issue.
And what kind of content's on there at the moment? Is there any specific areas that are doing very well?
So I'm an ENT surgeon. So a lot of it started in ENT. So we have a lot of anatomy-based experiences around ENT dissection. We have a lot of core kind of emergency procedural training, like how to pack a nose for nosebleeds and how to cauterize a nose if someone's having a nosebleed. But it's quite wide-ranging in terms of content. We haven't limited it to a specific discipline. So we have experiences that teach you how to approach an ambulance, an air ambulance safely. We have communication skills training, and when we're not limiting it to specialty. We build what educators want to meet educational needs of their learners.
And so, any member of the NHS, you're saying, that can go onto this platform and look at these videos. Do they need an account, or do they need to install an application? How does it work? So
the platform's powered by a progressive web application, which does have a login interface. So anyone with an NHS email account can log in completely for free. And we have NHS single sign-on integration. So it would kind of automatically in the background create an account. If you don't have an NHS account, you can still log in with a doctors.org account and various other ones. But also, if you're a healthcare student, so if you have an ac.uk account, you can get in also for free.
Wow, so that's really cool to know, because there's people out there that just they're itching to get their hands on this technology, and I think we've found it ourselves that we want to share, because we've been creating 360 videos for a long time. But then we're plagued with, the file sizes of the content. You can't just email it to people, And I think, I'm sure you had this conversation with Chris over at NHS England, because they've been trying to do something on the Learning Hub for a while, haven't they? We're hosting 360-degree videos and stuff. But because of the size of these files, I mean, how does your browser handle all those kind of things?
So it's all variable rate. Streaming directly into the 360 player, and it's all hosted on AWS. So yeah, we're not limited by file size or the fidelity of the video. We don't have those same limitations.
So if you said that it's accessible for people to watch. Is it accessible for people just to upload their content onto the browser?
No, and we often get asked that. So people often talk about being able to just upload anything. No, we kind of curate it. We don't want too much overlap of content at the moment. And we also have to ensure that it meets certain kind of performance, sort of technological performance criteria. So we kind of curate the content depending on the format that it's delivered to us in.
Okay, so you maybe a little bit of quality control there, so people can't, before you know it, you just got hundreds of videos, and none of them have really got no substance to them, that kind of stuff.
Yeah, exactly right.
Is there somewhere where you can upload, adjuncts, documents alongside these videos? For instance, maybe debrief notes or scenario instructions, pre-briefs, that kind of thing.
Yes, yeah. So we have a kind of area below the experience on the web application that we put some sort of intended learning outcomes there, but also links out to additional material. And like you say, debrief notes or lesson plans are often what we would link out to.
Yeah. And what kind of feedback have you been getting off of people about these the videos that are on there?
Yeah, really good feedback. I think we're kind of constantly reacting to feedback in terms of feature sets and changes to the user interface and things like that. But overall, I mean, in that NHS England call, we had lots and lots of people sign up during my talk, and they were watching it in their VR headset during my talk, which is really nice for me to hear. And I heard that from multiple different people afterwards. Nice to know that anybody with a VR headset can just get into the platform for free without much fuss. So yeah, definitely on the video side, we get really good feedback.
Is there somewhere on the website, if I watch the video, can I leave direct feedback for the video that I've just watched, or how's the feedback done?
At the moment, no. At the moment, no. We kind of rely on we rely on projects that we're running, to get formal feedback, or when we're speaking to our users or our clients as well.
Is there any type of specific videos that you're looking for that you don't have access to? So if people are like hoarding their videos, who would you like to come forward to maybe put some stuff on?
Oh, that's a good question. No, I mean, we are at the start of this kind of journey, and we probably have around 120 experiences on there. So across the NHS, in all disciplines, in all specialties, in all seniorities, there is a lot of content that we're looking for to host and to create. So much of our content at the moment we've created internally ourselves. So Nick, one of the co-founders of my platform, he is excellent at 360-degree videography and using cinema cameras to augment the view with picture-in-picture. So we're only really just starting taking third-party videos, and actually there's a really amazing chap, Nick Perez, who runs those meetings, actually just delivered us some of his content to put on the platform, which will be going live today, actually. So yeah, no, at the moment it's early days. There's a lot of content that would benefit from a distribution mechanism like ours. So we're all ears.
Yeah. I mean, does it work very well on, say, an NHS computer with NHS internet? Would it work well, do you think?
I think it would depend on the digital readiness of the specific trust, and it's variable bit rate depending on Wi-Fi connection. So where we have tested it in various different trusts, it has worked well, and yeah, it really does depend on the kind of strength of the internet connection for those experiences.
Yeah, I mean, what kind of resolution are the videos? Do you know?
So they're actually filmed in 8K, but at the moment the headsets we've not pushed it to stream 8K at the moment. But in time we would expect that we'll be streaming in full 8K.
Yeah, I mean, because most of the headsets people have are 4K anyway, aren't they? Really?
Yeah.
I mean, it just seems a little bit wasteful or a bit too demanding if you're pushing that kind of stuff out.
But if you've experienced 8K 360 video, it is absolutely brilliant. In terms of the detail. But yeah, sometimes we're kind of future-proofing the way we've created content. We're kind of future-proofing when the hardware and the digital readiness of our, NHS, can handle streamed 8K video. But I'm not sure many institutions at the moment can.
Does the platform allow you to download any of the videos once they're on there? So, for instance, if I wanted to put them on a headset and keep them off the network, would that be all right?
At the moment, no. At the moment, we've limited to streaming. Partly, as we've alluded to, the file sizes. After about 5 minutes of 4K, 8K, 360 video, the file sizes get pretty huge and a little bit tricky to manage. So we're limiting it to streaming at the moment, and for the foreseeable future, we're going down the road of streaming.
Yeah, and do you accept any videos that are not 8K? Because I know an 8K camera, it can be quite pricey. Looking at $5,000. What if someone just shot it on a 4K camera? Would that be fine still?
Yeah, I would absolutely look at that.
Yeah, I say that because it's very selfish. I only have a cheap Insta 1X2, I think it was. I think it was £300 back in the day. But if you're looking at 8K cameras now, I think they're probably in excess of $5,000 out there, really.
Yeah, I mean, the point is, I think the main point to make is about making content accessible to as many people. So I don't think that resolution is the single most important feature of these educational resources at all. I think there's a lot of other factors to be taken into account, and resolution isn't something that we often talk about, really. It's not often something that we get criticized for, not always being able to show 8K video.
Yeah, I mean, I think the last video I was looking at was because we had an IMT course coming up, so we were looking at more of the practical skills ones, like the lumbar puncture, those videos. And they're really high quality. And what I liked as well is the use of I'm going to call it dead space. So, the use of the cameras to your flanks. So if you can't quite see, because of he's got his back towards you or some finer detail, you can look to the left and you can see another camera. I mean, how is that practically done? Do when you're on set, how is all that kind of stuff done?
So, yeah, I mean, I'll make a point on that. So I think it's a really important point you make, and a really good opportunity for 360 video experiences. Our main aim is to get an optimal view for the viewer, to almost improve on the view that you can get if you're there in the room. And we've got a lot of experiences where we filmed operations on, the latest of which I think were filmed in Alder Hey Children's Hospital. So the operations on children there, and actually the medical students are sometimes at the back, within the experience there, at the back of the room. And our 360 camera placement with the picture-in-picture, what you're talking about, really gives the potential for a really optimal educational experience. So using that dead space, especially when you can't see in the direct 360 view, I think we get really good feedback about that.
Yeah.
And your question about practicality. So it's everything that people often get a bit worried, especially when we're talking to comms teams of NHS trusts, that we're going to rock up with a massive TV crew and take over the operating theatre for a week. It is just one guy. He comes with 2 robotically controlled cinema cameras and a 360 camera. And he tends to not even need to be in the room during the filming. And for certain operations, we filmed a knee replacement surgery, and it's important to limit the number of people in the room because of the risk of infection. So you can control these cameras from outside. So practically, it's quite lightweight.
So you're saying you actually recorded a 360 video of a real patient?
Several. We have experience based around a real mastoid surgery, tympanoplasty, so repairing a hole in an eardrum, a knee replacement surgery, and we've got quite a few more planned in the future as well.
How did you get around? I'm going to hate myself for asking this. How did you get around, the consent? Well, not so much consent, but governance. How did you get people to let you do this? Because I think we've struggled. So what we wanted to do is we wanted to live stream what was the HoloLens, and we wanted to use the surgeon's point of view, using the HoloLens to stream over essentially teams, but surgeon's point of view using teams to a room full of students. And we just couldn't get, I can't remember what the name of the document was. It had a horrible acronym, but we just couldn't get people to sign us off on it. How did you manage to get through all those kind of hurdles?
It's actually not been too bad. I mean, there's been for each one, especially the earlier ones. I think the first real patient filming we did was within the Robert Jones's orthopedic hospital. And yeah, it was a lot of open conversations with the comms team, and often some of these conversations go up to kind of hospital board level. And there's a lot of scrutiny on the platform in terms of data protection. There's also, we have legal documentation around location agreements, and everyone that's on camera needs to have signed a consent form, which often the trust comms team have their own consent form. It's become easier as we've done one. It's become easier to do more in the future.
Well, you've got evidence now, haven't you? Actually, this is where, look, this is the result of what we can do if you let us do it.
Exactly. And I think what people like is that, operating theatre education is a finite resource. We're needing more and more surgeons to be trained clinicians, nurses, operating theatre practitioners. And this is one way to increase the experience and exposure of those really high quality but expensive educational resources. So as we go, I think one experience can be, learned from thousands of times. And when you look at it that way, it's quite an easy sell. But yes, lots of meetings, lots of people. Comms teams have been absolutely brilliant in many of the NHS trusts. We've done real patient filming. And there's probably 4 different NHS trusts we've done this in now.
Yeah, what do the patients think? I mean, do they obviously watch the videos back themselves?
No. So yeah, because the access is limited to healthcare professionals. Patients generally, ExR don't consent the patients directly. The hospital, the doctors who are doing the procedures do, with the help of the comms teams. But no, we've not had many. I don't think we've ever had any patients think very negatively about it. People generally want their doctors and nurses to have as much educational opportunity as possible. Yeah,
we found it was never we could always get consent. You'd always have patients wanting to do this kind of thing, but it's normally the people holding, with the red tape.
But I mean, to argue that, the counter, I can completely understand. It's novel. I can understand if people aren't used to having film crews in their hospitals. It is so important that we protect the patients in the end of the day. So we don't see it as hoops. We see it as, we've got this catalogue of forms that we've had to sign over the years and for each experience. And it gets easier every time because the questions that were asked are always the same questions.
So you mentioned that 360 was only part. What did you say the other? So you mentioned maybe a 6-DoF type of virtual reality game kind of.
Yeah. So the complete difference, I guess, 360 video is generally sort of passive in the sense of you're stood within the video, but you're still watching the video, and you can add interactivity, of course. But the fully immersive 6 degrees of freedom serious games require a headset so that you're in a fully virtual, fully immersive environment with objects and patients that you can interact with. You can examine them potentially. You can pick up and assemble objects and go through a kind of a sequence of a procedure. But this is all completely interactive, so you can do it in the way, you can pick up things in the way you want to pick them up. It's quite a different experience, but it's more like a video game for a VR headset applied to education.
And I assume that this is much more complex in creating rather than just bringing the camera in. Is this done through, what kind of methods do you use to do it?
Yeah, you're right. It is more resource intensive, but I mentioned Nick as the cinematographer, who's a co-founder, but we have Ben, who's a 3D artist who runs those kind of games elements to our platform. So yeah, we have a few different environments that every one of our experiences sits within. So an operating theatre, a sort of emergency resuscitation cubicle, and a primary care kind of consultation room. So they're built environments that we reuse and that have all been drawn from scratch by Ben. And then any of the objects we create our own 3D models for, and then it's all put together in Unity Games Engine and deployed to the platform.
Yeah, and I suspect that's, when we think virtual reality, this is kind of what pops into people's heads, isn't it, rather than 360 video. They expect that they're going to be the surgeon and they're going to be, using the tools to do X, Y, and Z. So a bit more traditional VR. Does that mean that this obviously can't be done on the Windows browser using a mouse or anything like that?
For now, no. But watch this space. Hopefully, at some time in the future, we'll have simplified browser versions. It's something we're planning with, toying with, but we haven't started development on that.
Can't just load it up on the Xbox yet.
No, not yet. Maybe PlayStation VR in the not too distant future. It requires a headset, and so the best of what we do combines the two. The research projects that we've been involved with from when we've sort of independently tested the platform in universities combines the two. It combines a 360 video of a procedure which shows you the real world, the sort of exacting detail, and then you go and do a game version, a 6-DoF version, and that kind of allows you to develop some of the muscle memory and think about the sequence of events to safely perform a procedure. And that combination of those two experiences is the most educationally powerful, for sure.
And is this just a British thing? I mean, is there nowhere else getting involved, or is it plans to go international?
So at the moment, it's certainly built within the NHS for healthcare students within the NHS. But we're deploying the technology elsewhere, sort of even not medical industries. So the technology itself is agnostic of any specific sector. So for example, we're building experiences within the transportation sector, and it's on that side we imagine that things would go outside of the UK more easily.
And where do you think you'll be in, or where do you want to be in 5-10 years' time? What's the dream?
Me personally, or ExR?
Are you not? Well, you are ExR, is what I've heard.
Yeah, I mean, as we grow, we in 5 years' time, I guess we have the ambition to be the central VR platform for the NHS. Certainly, it's being used across. We have users from over 50% of NHS trusts, and we've collaborated with over 20 NHS trusts, and we expect to grow that. And as time goes on, and certainly within 5 years, we'd hope to have some formal involvement from central NHS England and Wales and Scotland. So I guess in a nutshell, we'd like to be the VR education platform for the NHS.
Yeah, from everything that I've seen, I think that's completely doable. We see a lot of ambitious projects come through, but this I really think it's got a lot of legs, and it's doing what a lot of people have tried to do. We've tried to. There was ideas about hosting things on like SharePoint, just throwing videos in there so people can upload them and download them, and we're going through a host of other issues there. But it seems like you're doing what people have been trying to do for a long time, and it's up and running. And from what I've seen, it's doing it really well. So good job and thanks. Personally, I love using 360 video and seeing what people are doing out there, because I believe a lot of people are working in silos, mainly because we are as well. We've probably got 20 360 videos, varying degrees of quality, but throughout loads of different specialities where we're using this on a daily basis, with regular face-to-face simulation and 360 videos, and it's great to see, what other people are doing. For instance, we never really thought about doing, procedural skills and using it as an educational video. We've mostly been just recording simulations, and it's that kind of, that drives innovation and sparking your ideas. So it's brilliant to see what you're doing. If people want to learn more about what's going on, and how do they get hold of you, and where can they find all the information?
Yeah, sure. So, I mean, if you wanted to have a look at the content library, you can just go to app.exr.education. And as we've discussed, it's free to sign up for an account for most people that would be interested in the UK anyway. And if you wanted to email me to talk about the platform, then it's Jonny@exr.education.
Well, thank you very much for coming on and talking to us today, Jonny. It's been brilliant, and I can't wait to see where you're going to be in a few years. But watch this space. I'm talking to Nick, and we've got a few things in the pipeline, and hopefully you'll be seeing some of our content on there. If we're good enough, obviously.
I've seen your content. It will be good enough.
We'll see if we get through the quality control that we've been talking about.
Thanks. Yeah, thanks for the opportunity and the invite, Craig.
No worries. Thank you very much, Jonny. And that wraps up another episode of the SimTech podcast. A huge thank you to Jonny for joining me and sharing the insights into ExR and how it's making 360 video more accessible for healthcare professionals. It's exciting to see how immersive content is shaping the future of simulation-based learning. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with your colleagues. If you have any more thoughts or questions or ideas for future episodes, feel free to reach out. You can find more details and contact information in the episode description. Thanks for listening, and I'll catch you next time on the SimTech podcast. Until then, keep innovating and pushing the boundaries of simulation.